Hello viewers, welcome to my channel. I am Puspen Dasgupta, an Indian ENT specialist, and I try to upload new videos on YouTube at 9 pm Indian Standard Time every day of the week. But some occasions ask for exceptions. Today is one such exception. Today I will start a new series. Hopefully there will be many episodes in this series where I will be talking about specific aspects of ENT with people who are well versed in it. The inaugural episode is with Dr. Mainak Maitra, who is extremely experienced with cochlear implants. So, if you are an ENT doctor, I'm sure you will be curious about cochlear implants. I hope this video helps you learn everything that you wish to learn about cochlear implants. You will surely enjoy watching this video because Dr. Moitro has been able to throw light on cochlear implant in a manner that I have never encountered in my life before. So stay tuned. So we will discuss cochlear implant with Dr. Mainak Maitra. Dr. Mainak Maitra, welcome to my channel.
Thank you, Dr. Puspen. It's been an honor to be sharing this space with you after such a long time.
Yes, I have known Dr. Mainak Maitra for many years, and finally he has agreed to join me on this channel. We will discuss cochlear implant because Dr. Mainak Maitra has a lot of experience with this particular aspect of ENT. So, cochlear implant, the first time I had heard of it, I had felt it is a tool to eradicate deafness. Dr. Moitra, do you agree with me?
Yes, definitely, it's definitely an implant which will help in eradicate deafness in the near future. Till now, I would not say that it is eradicating deafness to some effect, but by the term eradication, what we mean, it's on a global scale rather than on a particular area or location. So definitely, I would say that in the upcoming future, with the increasing number of implantations, with day by day as it is going on, we can only hope that this device definitely will help in eradication of deafness, not only across the country, but also across the globe.
Yes, so that is the hope. In my opinion, it is the best surgery known to mankind, not just ENT, but overall everything. So, with that introduction out of the way, we will discuss step by step the different aspects of cochlear implant, and Dr. Moitra will help us understand this better. So, the first question that comes to mind is cochlear implant is, of course, a device that helps in eradication of deafness, but how does it work? What is cochlear implant? So, Dr. Moitra?
Yes. So if we say it in simple words, a cochlear implant is basically an electronic device which helps patients to hear. Now, if we say it in the scientific language, it would mean that basically cochlear implant is a transducer. Now, if we remember that a transducer is a device which helps in the conversion of one form of energy to another form. Now, this cochlear implant helps in conversion of sound energy to electrical energy, which helps in stimulation of the auditory nerve. Now, the question which often comes is cochlear implant a hearing aid? Definitely not. Hearing aids are basically mini amplifiers which are placed in patients' ears, which will help in amplification of the sounds such that the patients can hear. But this device is applicable to those patients who are not getting any benefit from these amplifiers. So these implants or medical devices which are being used are actually converting this sound energy to electrical energy, which is stimulating the auditory nerve located in the cochlea and thus allowing the patient to appreciate the noise or the sound from which he or she has been deprived of for such a long time.
Yeah, very rightly said. So, people who are not even benefited with hearing aids and who might be giving up on the idea of hearing, they stand to benefit with cochlear implants. Moving on, the next
Definitely.
question that comes to mind is when can cochlear implant be used?
Now, regarding the usage and the indications of cochlear implant surgery, we can broadly divide this into two categories of deaf patients. First one, grossly speaking, includes the pediatric age group and the adult patients. Now, coming to the pediatric age group, also, we can divide them into two broad categories: the prelingual and the postlingual. The prelingual are the patients who have not yet started speaking, and the postlingual are in those children who have developed the speech, but after some time, due to some unfortunate event, they have lost the power of hearing. So, coming to the pediatric age group, which forms the main bulk of implantees in our part of the world, especially in a developing country like India. So, children who have bilateral profound sensorineural hearing loss are the usual candidates who can be considered for implantation, provided they are not getting adequate benefits from hearing aid usage for 3 to 6 months. Moreover, not only this will be used in the candidacy criteria. There are few other candidacy criteria which have been specifically mentioned, especially by the organizations or the schemes who are providing these implants for the children, such as the all India basis, we have the ADIP scheme. And in this part of the country, we have the state-sponsored, government-sponsored cochlear implant scheme, where we are also considering the patients who definitely their age should be less than 5 years of age. And also the patient should have an adequate development quotient level. If it is low, we do not opt for cochlear implant surgery. They should have a minimum developmental level of 70 or more. Sometimes these values change with the specific scheme concerned. And also, moreover, we will be considering the radiological imaging in the form of CT scan and MRI in these children, so that we can ensure that these patients are having normal cochlear nerve, which is an essential criteria for implantation, that the patient or the implantee should have a bilateral normal cochlear nerves, because without the cochlear nerve, this implant cannot be used. So this is in a nutshell regarding the indications of the pediatric population, prelingual, whom we are considering, and also the postlingual, which will be applicable for more than 5 years of age in such cases. But coming to the case of adults, in adults, the criteria is not that strict because they are considered as postlingual in majority of the cases, if not all. And in case of adults, unilateral, bilateral, profound sensorineural hearing loss patients who are not getting benefited from hearing aid usage can be considered for cochlear implants.
So this is an important point. Even unilateral profound sensorineural hearing loss patients who do not benefit with hearing aids still are suitable for cochlear implants.
Definitely, yes.
So this is the benefit we have in India. In UK, NHS does not sponsor unilateral profound SNHL. So this is for those people who find nothing
in India, the adults are not getting sponsored from any. There is no sponsorship available or insurance coverage for cochlear implantation. As far as I know, in the what we say the so-called quote-unquote developed countries of the world, we are still in a developing phase. The implantees or the implant candidates are majority belonging to the adult population.
Yes.
More than the children, because there the quality of life is more important rather than the other parts of the considerations. But in India, unfortunately, adults, maybe due to lack of awareness, maybe due to lack of motivation, the adults are still considered as any implant or a hearing aid is considered as a taboo regarding the usage in this part of the country. So, but definitely children, the prelingual children or children who are suffering from congenital deafness are gradually increasing in number. We are getting more and more patients who are willing for the surgeries and also undergoing the surgeries at the same time. So let's hope somewhere in the near future, adults will too come under the consideration of sponsored implantations, which will definitely increase the number of implantations.
Yes, so even in the NHS, this is a very important debate regarding, because of course, a unilateral profound SNHL is also a very debilitating condition, and people do want improvement in hearing. Even in the UK, outside the NHS, private practice does allow, and some military funding also allows unilateral cochlear implant. However, the important point that Dr. Maitra highlighted is it's extremely beneficial for prelingual children, that is just before speech develops. Sometimes I have noticed in my practice that people don't even notice that their child is not speaking. And by the time they
Yes.
present to the ENT doctor, it's already more than 5 years or 6 years. So what is the right course of action in that situation?
Look, the ideal age of implantation, what we say is as early as possible. We have documented implantees at an earlier stage of around 10 months in this part of the country. But the main point is that identification of the condition that the child is not being able to hear. So what can be done is definitely neonatal screening should play an important role to identify these children at the earliest so that they can be referred to an ENT surgeon for necessary investigations like beta and other sorts which are definite in the workup for cochlear candidates.
Yes, so it's very important. We will get to the special test a little bit later. So
Yes.
that is an important point that Dr. Moitra highlighted. So yes, this is the next point. What are the tests? As Dr. Moitra said, that neonatal screening, I don't think it is universal in India. It is universal in many parts of the world. If it is not
Yes.
universal, then it is very difficult to understand which child is having a problem and which child is not having a problem. I think, in fact, in some countries, universal screening happens as soon as 1 month of age. And by 6 months, they're already on cochlear implant pathway. So,
Yes, absolutely.
yeah. So, Dr. Maitro, what are the special tests that are done before cochlear implant?
Sadly or unfortunately, we are still lagging behind in universal neonatal screening, but definitely we hope that someday it will be made compulsory. But till now, what we are trying to propagate among our pediatrician colleagues is that whenever a child is born with high risk factors, but so for that we need to understand what are the high risk factors which can cause this kind of issues in a child. So number one is low birth weight, preterm births, uh, births to a high risk mother who are suffering from diabetes, hypertension, who had infections like torch infections, children who needed NICU admission immediately after the birth for cases of jaundice, pneumonia, meningitis. So these are the high risk children who should undergo definite neonatal screening at the earliest to exclude the possibility of hearing disability. So for that, what we usually prescribe is an otoacoustic emission, or what we call as an OAE. So as we know, in otoacoustic emissions, there are two results which can be obtained. One is a pass and the other is a refer. So the moment we find that the child is having a bilateral refer, we understand that this can be a potential candidate for a hearing impairment patient. So next, what is done is that we follow up the child after a few months, and then we go for beta. That is, we all know brainstem evoked response audiometry, what we call it. So after beta, the moment we identify that the child is suffering from a bilateral profound sensorineural hearing loss or hearing loss. So next is, as early as possible, we try to rehabilitate the child by providing hearing aids, and the child is made to undergo speech therapy, speech and language therapy. So earlier it was considered that 6 months of speech and language therapy should be done in a strict basis along with the hearing aid trials. But now we have reduced this to 3 months. If there is no improvement in 3 months, we consider this child as a potential cochlear implant candidate unless otherwise. So the moment the child is not getting any improvement from hearing aid on regular assessment, what we do is next we go for certain investigations like the HRCT temporal bone and the MRI brain. Now, HRCT temporal bone helps us in assessing the anatomical variations or any anomalies which may be present in the child. And the MRI brain, which definitely help us to understand any possibility of leaks, such as CSF leaks, which can be easily ascertained. And most importantly, the presence or absence of the auditory nerve, which is of utmost importance. So what we do is that after these patients have undergone a CT scan and an MRI, we immediately send the patients simultaneously for a developmental assessment to a proper psychologist we have at our center for developmental quotient assessment. Now, all these investigations go hand in hand, and we are documenting the cases. And after hearing a trial, we go for an aided audiogram. So, if the aided audiogram is a objective test where the response can be documented. If the response is below the speech banana level, we can definitely say that the hearing is not serving its purpose. So next, the moment we understand that this candidate, okay, this will be the candidate who will be a cochlear implant candidate, after considering all the factors that I have discussed, next we go for a definite vaccination of the child of meningococcus and pneumococcus. Now, after minimum 4 weeks of vaccination, we do the routine investigations of the child required for any surgery under general anesthesia, which is done. And further, we go on with the surgery.
And is there any role of ASSR or BERA in this child?
Yes, there is definite role of ASSR in this line of investigations. But since we are doing it under approved government schemes and sanctioning authorities, and moreover, ASSR is not routinely available at all centers which are providing these children to us for implantation. So we have kept this as add-on investigation, not a compulsory investigation. If it is available, fine, we'll do for an ASSR. But due to resource, resource crisis, all these factors come into play, the financial basis, the financial outcomes, whatever it is. So we always, definitely ASSR has an important role, but it is not a compulsory test in our institute where we are performing these implants.
So that's an important clarification there. When I was a student, ASSR was mandatory all the time.
Yes.
So
Yes.
as far as HRCT is concerned, if Dr. Maitra can elaborate further for the benefit of the viewers, there are some inner ear conditions where cochlear implant is contraindicated, which can be detected on HRCT. Am I correct?
See, with the current era of advanced implantations and advanced surgical skills, frankly speaking, contraindication to cochlear implants, the risk is gradually reducing day by day. Okay. Because even in the most difficult of cochlear anomalies, unless there is a cochlear aplasia where the cochlea is absent, that can be considered as a contraindication. Otherwise, in the other cochlear anomalies which we know, such as the incomplete partition, the cochlear dysplasias, the common cavities, there are loads of implant modifications which are available for these specific cochlear anomalous situations, which will help us and does help us in proceeding on with the surgeries.
So this is the benefit of talking to someone who is doing cochlear implant on a daily basis. That's a very important clarification that Dr. Maitra pointed out.
Now, even in these circumstances, sometimes earlier what we often thought when we were working together, if you can remember, that the children should have had a dry ear, right? The child should not be having any active chronic otitis media and things like that. But in the current situation, yes, definitely it is always preferable that the child should have a dry ear. But supposing we have circumstances where you can't help it, the child need a surgery for the chronic otitis media as well as the child needs a cochlear implantation. So in such cases, what we straight away go for a subtotal petrosectomy and proceed on with the surgery. Because the moment we perform a subtotal petrosectomy, it is guaranteed more or less that the ear will be absolutely dry in the near future. And after removing all the disease, whatever is there, then we can go for the implantation and the results are not that different, more or less similar results.
And on a lighter note, do children completely get shaved the head, or
yes, definitely
been modified?
Definitely.
Okay.
No. Definitely, we always prefer complete shaving of the head, and sterility is of utmost concern of cochlear implantation, because in the institute where I am currently attached to, we have had around nearly 180 implants which have been completed. And despite the best efforts from our side and the OT staff and everything, we had 3 cases of wound infections, and 2 of them, the implant had to be removed due to this infection.
That's an important point.
Surgery
180 cases over a period of?
Over a period of since 2017, that means 7 years.
Okay. That's a great number. So moving on. Now, Dr. Maitra, how long do the patients have to stay in the hospital if they undergo cochlear implant surgery?
Yes. This duration of stay in the post-operative period, there are no such clear-cut guidelines that has been mentioned in the literature. It varies from institute to institute, and also, moreover, in which part of the world the subject or patient. Like in the Western world, often can go back home in the evening.
Yes.
But what we follow in our institute, we are a bit overcautious, definitely, because of infection and sterility, as I was saying. We discharge the patient 7 days after surgery, after completion of 7 days of antibiotic therapy.
Okay. So that is drastically different from the situation in the UK, where it is done on a daycare basis. Cochlear implant is a daycare surgery in the UK. Even I was shocked by that. So 7 days for antibiotic therapy.
Yes.
Okay.
Intravenous antibiotic therapy.
Intravenous antibiotic therapy. Okay. So following cochlear implant, there is a huge role of speech therapy. What is done in your institute regarding speech therapy?
Yes. What we always say to our patients' caregivers is that speech therapy, post-operative speech therapy, is the main thing which needs to be followed after the surgery. If a total of 100 is considered, 20% is the surgery and the rest 80% is on the speech therapy. So meticulous, proper speech therapy is of utmost importance. In our institute, after the surgery, we switch on the device at 3 weeks of surgery. Now the speech therapy starts usually on weekly 3 days for 6 months, and then it gradually tapers off to 2 days per week for around the rest follow-up. Okay. It also depends the patient-specific outcomes is also important in this case. Some children respond better, some children don't, due to various factors which can be considered, like age of implantation, which is a very important role. The earlier the age of implantation, the better response. This is the clear-cut outcome that we have really documented in our centers. So in such cases, children who are lagging behind a bit, not meeting our expected outcomes, so definitely we continue their thrice weekly speech therapies for a longer duration than the other children who are responding better to the speech therapy. We gradually taper them to 2 days of speech therapy.
So speech therapy largely depends on the response of the child.
Yes, definitely. At the beginning we start 3 days per week, and then for 6 months we do that, and by that time the speech pathologist and the speech therapist definitely assesses the improvement that the child is having, and after that they decide on with the further schedule.
Okay, so that's also very important. Lots of people don't understand that cochlear implant surgery is just the first step, and speech therapy, as you said, 80% of it is speech therapy, which requires a lot of motivation. I believe motivation was also a factor that is assessed before performing cochlear implant surgery.
Yes, definitely. We often sit with the parents of the children regarding what is their expectations, because what we ensure is realistic expectations. A child who is definitely, we have children who have undergone implantation and now are reciting poems and performing on the stage. We have a special day like World Hearing Day, 3rd March, where these children come together and we perform specific programs where these cochlear implant candidates they perform various activities like recitation, singing, dancing, all this kind of stuff. So what we tell them is you need to have realistic expectations. It's not magic. It's dedicated hard work, both on parts of the surgeon and also on the part of the parents. They should not give up. They should meticulously follow the speech therapy schedules. If they don't, it is their child who will be hampered from this, what to say, if they are not following up the things properly.
And there's also an important role played by the speech and language therapist.
Definitely.
Okay, so moving on, I think this is probably the most important question. Dr. Moitro has described cochlear implant very beautifully, better than almost anyone I know. So it sounds like a very expensive procedure. How is such an expensive procedure affordable in a country like India?
Look, the expense is definitely one of the factors which limits the number of implantation in our country, because we still don't have enough sponsors for these patients to undergo implantation. Now, if I give you a relative idea regarding the expense of the device, the implant itself, there are various companies, I don't want to name them, but there are various companies which are providing the implants, cochlear implants. And more or less on an average basis, in Indian currency, if we consider, the implant prices start from around 7 to 8 lakhs. Okay. So now there are higher generation of implants which will cost more. So leaving aside that, so 7 or 8 lakhs is the base price of any proper baseline cochlear implant. Okay. Now next is the surgical aspect, the expenses, the A. So more or less, everything to be considered, more or less, if we take it on the minimum scale. So for easier calculation, we consider 10 lakhs as the entire package for any
10
cochlear
lakhs
surgery.
Indian rupees.
Yes. Sorry?
10 lakhs Indian rupees.
Yes, 10 lakhs Indian rupees.
That's
now, yes. So now the good thing about that, the central government schemes and currently the place where I'm working in Kolkata, I hope many of your viewers know where Kolkata is. You have international viewers. Kolkata is in the state of West Bengal in India, in eastern India. So in this part of the country, we have a state government scheme also. So this state government scheme provides these implants free of cost to these children. Okay. And the institute where I'm working, the surgery is also done free of cost. So basically the child don't have any cost or expenses for this implantation surgery. It is because we are trying to increase the number of implantation candidates, just because the burden of these congenitally deaf children are pretty high in this part of the world. So now, if we go to the private sector, the implants is definitely, the patient has to definitely buy those implants. So now, till now, as far as I know, they have to give their own money and buy those implants and make arrangements for the implantations. Now, there is also a good thing in it. What is that? Now, I don't know if any of you know or not, the DRDO, if you know, the Defense Research Organization,
Defense
in
Research
collaboration with PGI, in collaboration with PGI Chandigarh, we are on the brink, I would say, of developing an Indian cochlear implant, indigenous. These implants will be coming in the market pretty soon. And the cost of that implants, as far as I know, will be around 1 to 1.5 lakhs. So the cost of the implants will be dramatically coming down. And this research was started since 2003. I read this article regarding this, and all the top shot people, surgeons who are involved in cochlear implantation in India are involved in this project, because India is planning to launch its own indigenous government-sponsored cochlear implants, which I believe will be coming in the market pretty soon, and currently it is on the trial phase. So the moment that implant comes into effect, definitely the implantation rates will increase, because the cost is reducing by a great amount. And maybe in the near future, and hopefully the government will also come up with more schemes. Each and every state government will be coming up with more schemes to sponsor such candidates.
That is really great news. Very exciting prospects ahead. Moving on to the last point, and I could talk to Dr. Mainak about this throughout the night, but unfortunately, we have to bring this to an end because time is limited. So, Dr. Mainak, if you could share your own experience about one patient who gave their feedback to you.
Yes, not one. I would say we, the surgeons who are operating on these patients, we regularly call up these children and try to hear from their part as well as their parents' part what problems they're facing, what issues they're having, what improvements they're undergoing through the entire course of therapy. So the greatest thing I would say, as from a surgical team member point of view, is that when you see the patient for the first time, the patient can't communicate with you. And after a few years after surgery, which we have, like I told you, we have a special day, single day in the year when we call all these children together and they perform various cultural activities. It's a great pleasure when they send videos to us, the patient sending videos to us that their parents are sending that, look, my child is able to recite a poem, is able to dance to a music beats which they can hear. So this is really, really, I would say, a great feeling from a surgical team member point of view that we have given this child the gift of hearing, which this child was not having since the time of birth.
Yes. So I had read in different countries before we launch these programs, a risk benefit or a cost benefit analysis is always done. Like the expense
Yes.
for performing this surgery versus the benefit it provides to society. So considering every other surgery, including bypass surgery or joint replacement surgery, all of this, I believe the benefit provided by cochlear implant surgery is manifold, sometimes 4 times, sometimes 8 times. So it's
Yes.
really a no-brainer in terms of benefit, even for adults, not just for children.
Absolutely.
So, Dr. Maitra, thank you so much for throwing so much light on this issue. I'm sure this would benefit all the viewers who may or may not know as much. Certainly, I did not know as much about cochlear implant before I started talking to you. So,
No, I'm still learning. I would just say that in our field of surgical branch of otorhinolaryngology, uh, the branch is vast. And as we have discussed in our postgraduate residency days, we ourselves did not have enough ideas or views regarding the vastness of this surgery or the stream which we chose.
yes.
So definitely, I would like to thank you for promoting otorhinolaryngology or ENT to the common people, to the MBBS undergraduates, to graduates and postgraduates all across the globe at your level, I must say, because your channel has viewers from all over the globe, I've seen. So definitely, India needs to make more and more progress on ENT. I'm also trying to make progress on my aspect also. And we have all had our own share of luck and what to say, difficult situations we both had undergone. So, no, the main thing is that we should never stop learning and never give up and never stop dreaming regarding taking this branch ahead in the near future.
Very wise words. And Dr. Maitra also has a YouTube channel. I'll leave a link to it in the description below. So thank you so much, Dr. Maitra, and we will hope you will join us again on this channel very, very soon. Take care.
It's been a pleasure. Thank you. Thank you, Dr. Dasgupta.
I hope you enjoyed watching this conversation. If you wish to follow Dr. Moitro, I'll leave a link to his YouTube channel in the description below. Dr. Moitro is a very successful ENT specialist from Kolkata, so feel free to reach out to him if you have any ENT ailment. Also, feel free to leave a comment in the comment section below suggesting any further topics that you want me to discuss in greater detail. I hope you like this video and I hope you'll join me in the next video very, very soon. Take care, bye bye, and please don't forget to be awesome.